Diaz. I'm glad that you're all here. Appreciate having me. I want to talk a little bit about the NFLAG. Before I do that, I want to recognize a few folks. Our sponsors for the last couple of events that we've had here. GSG, Mr. Guillermo Garcia. Fusion has been a supporter for our website. HCA has been a very, very strong supporter, contributor to our organization. We want to ensure that we thank them. Aztec America, ProMed Resources, Mystical Solutions, and Affiliated Credit Services. A special note, I want to recognize Mr. Ralph Yanis, who's the Regional VP with AARP. Thank you. We also have Ron Estrada with NCLR. I want to introduce our past president of NFLAG, Hank Hernandez, who's sitting back there. Thank you, Hank. Mr. Fred Hobby with IMD. Thank you, Fred. We appreciate your support. And I want to recognize a young lady that has just been accepted to an internship program at the Colorado Hospital Association, as well as an ACHE scholarship recipient, Ms. Elizabeth Gonzalez. I think that's so important because that's what this organization is about creating those pipelines for the next generation of Latino leaders, and I truly believe that we are moving in that direction. I'm quite excited about what has taken place this last couple of years. For those of you that are new to the organization, 2005, ACHE and AHA identified a few folks, Latinos that were sitting in health systems and hospitals, and 15 of those folks met in Scottsdale and created a charter for this organization back in 2005. And we at the National Forum for Latino Healthcare Executives are excited to welcome you to our organization here this morning, as well as to grow our national presence and the network of Latino health professionals in the United States. I think that together, especially right now with the times the way they are, they're exciting times, they're difficult times, and I think it's appropriate that we as Latino leaders, healthcare leaders, are at the table talking about policy and reform. So I appreciate you being here and your involvement. With that, I want to introduce our management team. We have an association management team for the National Forum, and that's President Leadership Group, Mr. Roberto Carmona. He is the lead principal for the group that supports us. Also, I can't go any further without recognizing the lady that put all this together for all of you, not just here this morning, but last night, Jessica Cervantes. Thank you so very much. Next, I'd like to introduce Mr. Ed Martinez. Ed Martinez is a senior health care consultant. He also has just been appointed to the Health and Human Services Advisory for Minority Health Committee, representing us at NFLAG, but more importantly, Latinos across the board with HHS. So, Ed, if you would, please.
Before Ed comes up, I just want to acknowledge that Ms. Nancy Rivera from the City of Chicago's Commission on Public Health will be here, and also the Commissioner, Terry Mason, will be joining us later. So just wanted to let you know. Thank you.
Thank you, Michael, and welcome all to the National Forum's breakfast in conjunction with the American College of Healthcare Executives Congress. We thought in terms of the program for this morning, nothing would be more appropriate and more impertinent would be health reform. And no one that I can think of right now that could give us more of a background and more substance in terms of what's happening with health reform in Washington and around the country, particularly as it affects Latino communities, is my good friend and colleague, Guadalupe Pacheco. Guadalupe is the Special Advisor, Public Health Advisor and Special Assistant to the Deputy Assistant Secretary for Minority Health at HHS. Been on innumerable panels and committees around the country involving cultural competence, the development of strategies for addressing healthcare disparities, and assisting all our minority communities in terms of improving health and healthcare. He also, if you haven't been too much in the area of cultural competence and linguistic language access and healthcare, he really is the spirit and the force behind the class standards, which have been a real way for us to think about the way we provide quality care to our minority communities and those who are limited in their English proficiency. And he and his committee over the past couple of years have really developed a whole organization of how we think about culturally competent care, particularly, again, for people whose primary language is other than English. So, without any further ado, I'd like to introduce Guadalupe Pacheco, who will tell us what the heck is going on with health reform. So, Guadalupe.
Thank you, Ed, for those nice comments. You almost had me in tears. It's really first of all, let me thank the National Forum for inviting me to be here to speak to you about health reform. And that's a big agenda item, obviously, under Obama's administration. And obviously it is for me and the Office of Minority Health. I'd also like to thank Michael Knight, excuse me, the president of the forum. I think he's doing a great job. And also Roberto Carmona, the CEO. So when we give him a hand of applause. So, last night was when I got in. Ed was talking about I'm the expert. I think there's a lot of experts in this. I mean, it's an unknown territory. Let me put it this way, because it's going to be a battle. It's not going to be an easy win to get health reform, because there's going to be a lot of competing forces that are gearing up right now. And so I think one message that I want to get across today is that this forum and other Latino organizations really need to be at the table to make it happen. And that means contacting your Congress folks, your advocacy groups, you name it, because it has to be a grassroots kind of movement. And I think President Obama, community organizer, recognizes this, and I think that's why he's probably going to be out there even more as we gear up to push this health reform agenda. So with that, let me get started here. So this is the I'll probably spend about 20 minutes, and then I guess we'll have time for questions and answers. Can you hear me?
Yeah.
So Ed already introduced me. So this is what I want to talk about. Just about six bullets I want to cover. And so I want to just briefly state what the mission of OMH is, because I want to put my presentation in the context of who I work for. And then I'll talk about why health reform, healthcare costs, causes of disparities, health disparities, and then the Obama plan, key components, and then why Latinos need to be at the table. So I work for the Office of Minority Health, and basically our mission is to develop policies and initiatives that can help eliminate health disparities. We're like the lead advisor for the secretary. If she gets confirmed. And we're optimistic that she's going to get confirmed. This is the former, still governor of Kansas, Kathleen Sebelius. And we understand that right now she's making the rounds on the Hill, talking to some key congressional folks, especially on the Senate side, to make sure that she has the votes to get confirmed. And we think that will happen hopefully soon. Right. So as OMH, we're at the OS level. Within HHS, there's other